standards of care in animal shelters, and I'm going to cover the highlights of the animal transport and relocation section with you. As transport has increased, so too has the body of literature surrounding it, and you will find that this section of the guidelines has also grown substantially. Animal relocation programs are a critical strategy to support live outcomes. However, these programs can carry risks to health, behavior, and safety for some individual animals. Therefore, intentionally designed relocation programs consider the risks and benefits and minimize negative impacts through careful selection and planning. Decision-making must prioritize decreasing length of stay. Holding animals for relocation when live outcomes are available locally can lead to shelters operating beyond their capacity for care and compromising animal welfare. Likewise, if a destination shelter accepts more animals than they have the capacity to care for, the welfare of both the relocated and destination animals may be compromised and length of stay increased. It is unacceptable to transport animals when the transport itself is likely to be harmful to their immediate or long-term health or welfare. Careful management and planning are required to ensure that transporting an animal improves their welfare and that priority is given to animal comfort and safety. As discussed in the medical section of the guidelines, all eligible animals within a source population must be vaccinated at or before intake. It is insufficient to vaccinate only animals selected for relocation, as this will leave the majority of animals unprotected and at risk of infectious disease. It is also not recommended to hold animals back from transport to allow for a response to vaccination or to receive revaccination. To prevent the spread of internal and external parasites, treatment for fleas, ticks, and internal parasites is strongly recommended. Ideally, all dogs 6 months of age or older are tested for heartworm disease prior to relocation. Behavior medications should be considered when an animal is likely to have an emotional welfare concerns during transport. Assessment of transport suitability is especially important for these animals. Clear communication between partners is essential when behavior medications are used to ensure that both the source and the destination have a clear understanding of the welfare of the animal. Safe and humane relocation programs do not use sedatives or behavior medications to compensate for poor transportation practices. This slide contains just a few of the questions that should be asked when considering whether behavior medications are suitable and necessary for an animal undergoing transport. It is unacceptable for a relocation program to transport animals that are sedated or anesthetized to the point that they are unable to swallow, walk, or thermoregulate. This would put animals at severe risk of adverse events during the transport. It is also important to note that some of these drugs do have side effects and that there need to be plans in place to address that if something should occur during the transport. Clear and direct communication is essential for successful relocation programs. Written agreements between all parties involved in the relocation program should be developed and reviewed regularly. This development should occur prior to transport. Animal health and behavior must be accurately described and communicated between relocation partners. At a minimum, such agreements address medical and behavioral selection criteria, as well as transportation and destination requirements. A contact person must be identified at each transfer point, and a record of each animal's travel from source to destination must be kept. All participants in the relocation process must follow federal regulations for animal transportation, as well as local or state regulations for both source and destination locations. Additionally, there may be regulations related to the type of transport, for example, air. Departments of Agriculture and Departments of Health commonly have requirements for animals being imported into their jurisdictions. These often include health certificates and certain vaccinations. There may also be restrictions for age and health conditions. For commercial air transport, organizations must consult with the airline for specific requirements. During transport, animals must be able to posture comfortably inside their primary enclosure. They should not be transported with unfamiliar animals in their primary enclosure, and they should ideally be introduced to that enclosure prior to transport in order to reduce stress. The primary enclosure should not have sharp edges, and the flooring should be solid to prevent injury, discomfort, or leakage. Additionally, absorbent bedding must be provided during transport unless it poses a risk to the individual animal's health. When those primary enclosures are loaded into the vehicle, they should be done in such a manner that minimizes animal stress or discomfort while allowing for direct visual observation. Primary enclosures must be secured to prevent movement within the vehicle. Crates can be secured either through custom-built containment systems, rubber tarp straps, ratchet straps, or cargo netting. In an emergency, operators must be able to swiftly remove the animals. During transport, cats should be provided with a hiding space or visual barrier that allows ventilation and monitoring. For example, the kennel door can be partially covered with a towel, or a small hiding box can be provided within the primary enclosure. Stress can be further reduced if cats are acclimated to their carrier prior to transport and provided familiar objects with their own scent. Ideally, all cats are provided with access to a litter box during long-distance transport. Cats and dogs are ideally transported in separate vehicles. If cats are transported in a vehicle with dogs, they must be housed in a physically separate space with special consideration given to visual and noise barriers. To ensure safe and humane conditions, control over heating and cooling in the animal compartment is essential in any vehicle used to transport animals. Interior temperatures of vehicles in direct sunlight can rapidly exceed safe levels, even when comfortable outside. The temperature of the animal compartment in the vehicle must be monitored and action taken if low or high temperatures occur. Alarms can facilitate monitoring when drivers and animals are in separate compartments. Placing the thermometer at the level of the animals allows for more accurate monitoring. Generally speaking, the risks to animal health and welfare increase with the duration of transport. Therefore, driving time to an intermediate or final destination should not exceed 12 hours per day, and loading-unloading time of animals should not exceed 1 hour each. Confinement for these lengths of time can still present welfare concerns, so efforts to reduce the overall transport duration, including stopping only when necessary and coordinating stops to manage both human and animal needs, are strongly recommended. Transport that exceeds 12 hours of travel must be broken up with an overnight rest stop at an intermediary location. According to the Department of Transport regulations for vehicle operators, overnight rest stops are at least 10 hours long. Total transport time from the source to a final destination should include no more than 28 hours confined to a transport vehicle, including loading and unloading time and excluding an overnight rest stop. Unless there are extenuating circumstances, animals should not be returned to the source, even in the event of unexpected medical or behavioral concerns. Transport is a significant stressor for the animal, as well as a significant resource investment. If destination shelters regularly find that transported animals are not eligible for adoption, it is important for all parties to revisit selection criteria and program goals. Organizations engaging in relocation should track standard metrics for transported animals. This includes animal demographics, behavioral and medical conditions, and outcomes. It's important to remember that transport of animals affects not only those individual animals, but the community animals at both the source and the destination shelters. There are many stakeholders invested in animal life-saving and in our transport programs, and having appropriate practices allows us to minimize risk and maximize the benefit, creating long-term sustainability of these programs. Be sure to join us for the question and answer session to find out more.
Hi, I'm Elise Gingrich, one of the authors of the second edition of the ASV Guidelines for Standards of Care in Animal Shelters. Welcome to the overview of the medical health and shelter surgery sections for the Reboot Camp.